Monica and I will be the nurse for you today. I will wash my hands. Give me 1 second. Okay, what is your name?
Alexander Segui,
And your date of birth?
09/15/1991.
Perfect. Your date of birth matches and name too. Would you like me to call you by your name or date of birth? Or last name?
Alexander is fine.
Alexander is fine. Okay, so I will be performing a health assessment for you today before the doctor comes in. What brings you to the clinic today?
General checkup.
A general checkup. Do you have any allergies to food or medications or in general?
No.
No allergies. Do you feel any pain or discomfort at the moment?
No.
No pain. Are you comfortable? Is the light comfortable? Is the position comfortable? Is the room comfortable for you?
Yeah, this is good.
Everything is good? Okay, perfect. So I wanted to get a little bit of a history. Do you have any medical issues that I should know about?
No.
Like hypertension, diabetes?
No, I'm not. I have history because my father has hypertension and my grandma had diabetes, but that's it.
Okay. Do you smoke?
No.
Do you exercise?
No.
Do you drink caffeine?
Just coffee in the mornings.
Okay. Do you drink alcohol?
Just socially.
Do you do any drugs?
No.
No drugs. Okay. So I will start with the head and do a full assessment down to your toes, okay? I will be asking you questions along the way, and I would also need you to help me with some movements. Is that okay?
Yes.
Okay. Okay, so first of all, I'm gonna take your vital signs, okay? Sorry, these are sticky. Okay. So let's do your blood pressure. So for the purpose of this video, we're gonna do it here. It is not heart level, but you know that it should be comfortable and at heart level, okay? Perfect. Your blood pressure is 108/73, and your heart rate is 63. Right now, I'm going to also check your temperature. Just give me 1 minute. Perfect. Your temperature is 97, so your vital signs are perfect. Okay. Moving on, I will start with the head, and so I will start here on the head and the hair, okay? So the patient's hair is evenly distributed, and the scalp is dry but not flaky. The patient's hair is brown and wavy. It has some gray hair, but it's well groomed, it's clean, and is appropriate to the patient. Going down, I'm gonna check on your ears. So does the ear hurt? Does your ear hurt?
Yes. No,
Does
no,
your
no,
ear
hurt.
hurt?
No, no.
Okay.
I'm sorry.
Okay.
No.
Okay. So I'm gonna look. inside your ear. You have normal cerumen on this ear. I'm going to check the other ear. Perfect. Normal ear. I'm going to check inside. So no drainage, no lumps, normal cerumen. Let me also check on this ear. No drainage, it's dry, intact, and pink with no lumps, normal cerumen. Do you have headaches or suffer from headaches?
No.
No. Have you had any brain injury in the past?
No.
No brain injury in the past. Okay. So going down to the face, the patient's face is symmetrical. The skin is appropriate to the ethnicity, temporal bones. If you can clench your teeth, no, clench your teeth only. Perfect. Temporal bones. I'm also going to check your nodules here, your lymph nodes. Your lymph nodes here. Okay, perfect. So I'm going to also check for your movement. So if you can close your eyes, heart. Close your eyes, heart. Perfect. Open your eyes and smile. Perfect. Blow. Oh, perfect. And frown. Perfect. So you have your cranial nerve servant is intact. Going down to the eyes, I see that you wear eyeglasses. Why do you wear eyeglasses?
Because I use glasses since I have 3 years old. I was diagnosed with strabismus.
Perfect. So I'm gonna take your glasses out, okay, and check on your eyes. Perfect. So the sclera is white. The iris is brown. I'm gonna pull down and I'm gonna see on your conjunctiva here. Conjunctiva is pink and moist. The sclera is also intact. I'm gonna check on your pupils. The pupils are round, but I'm gonna do a test. So I'm gonna dim the light. Put the light back. And I'm going to shine a light on this eye. You're gonna look at me, shine the light on this light, and we'll see if your pupil constricts, because when you dim the light, the pupils dilate a little, okay? So look at me. Perfect. I'm gonna check on the other eye. Look at me. Perfect. So both pupil constricts and react to light. I'm gonna put the lights up, and I'm also going to check for your accommodation. So I'm basically going to point this finger at your nose, and you're going to follow with your eyes, okay? So this left eye accommodates perfectly. The right eye with strabismus doesn't accommodate as well. It stays a little bit to the side. Okay, so you can put your glasses back on. I'm going to also check for extra ocular motor movement. So I'm basically going to move my hands, and you're going to follow with your eyes, okay? So with this finger, I'm going to move, and you're going to follow with my hand, with your eyes. Perfect. So now look on the side. Perfect. Okay, perfect. So moving down to your nose. Your nose is midline, center to your face. There's no deviation of the septum, no lumps. I'm gonna look inside to see if I see any polyps or drainage. Do you have any problem breathing?
No, I don't have any problem.
Okay, so I'll look inside. Perfect. So can you close one nostril and breathe in and out? Perfect. I hear the breathing coming in and out. And try the other nostril. Perfect. Do you feel any shortness of breath?
No.
No. Okay. So I'm gonna look, come down to your lips. The lips are symmetrical, are pink and dry, but not chapped. I'm gonna look inside the mouth. If you can please open your mouth. The teeth are complete, and there's no teeth missing. There is no broken teeth. There are some cavities that were already corrected. The patient does not use any dentures also. So if you can open your mouth really wide, take out your tongue. Tongue is pink and moist. Say ah.
Ah.
Perfect. The uvula is midline. It goes up and down. I can see that the mouth is moist. The mucosa is moist. I'm sorry. The mucosa is pink and moist. It's intact. It doesn't have any ulcers. It doesn't have any lesions, and the mouth is perfect. I see that the patient has some facial hair, but the hair is evenly distributed. There is no patches or lesions on also the chin area. Okay, so moving down, I'm gonna go down to the chest area and the arms, okay? I'm going to change my gloves, okay? Because I was in your mouth. Okay, so speaking of the mouth, do you have any difficulty swallowing?
No.
No. Do you have any loosened teeth? Or feel that you have any loosened teeth?
No, no.
Okay. Okay. So can you sit up like this? Perfect. So can you move your neck side to side? Perfect. There's complete movement of the neck. Okay, so I'm gonna feel down for any lymph nodes or nodules on your neck. I don't feel anything on your neck. Okay, so when I hold here, shrug your shoulders. Perfect. They shrug against resistance. Also, let me see your trachea. Trachea is midline. The skin of the person is intact. Also, I'm gonna check for your jugular pulse. Perfect. It is present there and is bounding. Perfect. Okay, so you say you have no difficulty swallowing. The trachea is midline. It's appropriate to the person and and the age. I'm gonna go down to your arms. The arms the skin is intact. There are no tattoos. There are no lesions. There are no scars. There are no rashes. The temperature, let's see. Temperature is warm. Perfect. Can you squeeze your hands for me? Perfect. So let's do another strength test. Can you hold when I push? Perfect. So now can you push me? Perfect. So I'm gonna check your radial pulses here on both arms. perfect. Your radial pulses are both present, and I also, in the meantime, checked your respiration and it's okay. Like your respiration is 16, so it's good because you're just sitting and no movement. I also see that your chest is moving equally, and that is racing also equally. Okay. So let me also check here on your arms for any notes. No notes. Perfect. Okay, so I'm gonna move down to your chest area. Sorry, let me just look. So the chest has hair and is evenly distributed. There are no lesions. There are no lumps that I can see. I'm going to palpate. The skin on the chest is intact. Also, the color is appropriate for the patient and the patient's ethnicity. I'm also going to take a look at the back here, and there are some freckles in the back, but there are no lesions, there are no scars, there are no rashes also on the back. So tell me as I palpate, do you feel any discomfort?
No.
Does it hurt? Do you feel any chest pain?
No.
No. Okay, perfect. So for now, I'm going to listen to your lungs and your heart, okay? Listen to your breath first. Breathe in normally. Perfect. Perfect. I'm going to check. Also on this side. Okay, I'm going to check on the back as well, okay? Okay, so I hear normal bronchial sounds. I don't hear any wheezing, any bronchi. And you said, you told me you don't have any shortness of breath, correct? Or any difficulty breathing. Okay, so
No.
now I'm going to check on your heart and I'm going to listen to your heart. Okay. So for the purpose of this video, I'm doing it over the clothes, but it should be under the clothes, normally skin to skin, okay?
No.
Perfect, I can hear the heart sounds, S1 and S2. Perfect, I'm going to hear the echo. Perfect. Perfect, I can hear normal rhythm. Of the sound. Perfect. I'm going to do the same now to listen for murmurs, okay? With the bell. I don't hear any murmurs. I hear normal heart sounds with S1 and S2 present. So I'm going to go down to your abdomen. If you can lay down. Is that okay?
Yeah.
Is that a good position? Okay, so going down to your abdomen. Do you have any discomfort
No.
on your abdomen? Do you have any history of heartburn?
No.
Do you have normal bowel sound, like normal bowel movement? When was your last bowel movement?
This morning.
This morning. Okay. I'm going to first inspect your abdomen. Excuse me. Okay. So the patient's abdomen is flat and symmetrical. There are no lesions. The umbilical cord is midline to the abdomen. The patient's skin is warm and is intact. Their color is appropriate for the ethnicity. There is some normal hair distribution for the abdomen, and I don't see any scars, any previous scars, any wounds, or anything that indicates a previous surgery. You've never had any previous surgery, correct?
No.
On the abdomen. Okay, so I'm going to again listen to your abdomen for bowel sounds, okay?
Okay.
Perfect, I can see active, I can hear active bowel sounds. I am now going to palpate and you let me know if you have any tenderness, okay?
Right.
So the patient's abdomen feels soft. There is no tenderness, no pain?
No.
No pain and tenderness, perfect. I don't feel any lumps, any tumors, any nodules, no umbilical nodules, no hernias, nothing in the abdomen area. Okay. Okay, on the pelvis area, do you have any pain?
No.
Do you have trouble urinating?
No.
When was the last time you urinated?
Also in the morning.
Also in the morning. Do you have any pelvic here on the pelvic area? Do you have any pain? You said no.
No.
Okay. Okay. Check on your hips. Okay. No pain or discomfort on the legs here?
No.
No. Perfect. I can see that the knees are round and symmetrical as well. The legs also have hair, but they're evenly distributed. I don't see any lesions or visual lumps or visual nodules on the legs. The skin is also warm. The color of the skin is also appropriate for the patient's ethnicity. There is no sign of edema. There is nothing swollen, nothing protuberant looking on the legs. So I'm also going to do some strength test on your legs, okay? So if you can lift this leg for me. Perfect. Now this one. Okay, perfect. I'm also going to check your pedal pulses, okay? Do you have any cramping of your legs?
No,
When walking or exercising?
no,
No, like on your pain, no pain on your legs?
not at all.
Okay, perfect. Can you move your legs? Move your, like that, and this one as well? Perfect, so I'm going to hold here and you're gonna push. Perfect. So now you're gonna push 2. Perfect. Capillary refill on your toes. Arm. Close 2. Perfect. Okay. And also the capillary refills on your nails, on your arm, on your hands are also close 2. All nails are trimmed, clean, and pink in color. And and there is range of motion in both legs. Okay. So overall, the patient is alert to time and place and to situation. The patient is appropriate for his age, is well groomed and dressed, is clean, and the patient responds correctly to or appropriately to all the questions. So the patient is alert, like I said. The full assessment is complete. Do you have any questions for me or the doctor?
No?
Not at the time. Okay, so I just wanted to let you know that the flu vaccines are recommended yearly for the flu season. Also, the COVID vaccine is recommended to avoid getting COVID or at least getting mild symptoms. Also is recommended to exercise to prevent any osteoporosis or bone problems as we age. It's also recommended to maintain a good hydration and a good healthy diet to also prevent any health issues since you have diabetes in your family and also hypertension in your family, okay?
Okay.
That will be all for all. Thank you for participating.
Thank you.
I'm gonna bring down your legs, okay?
Thank you.
Have a good day.
Thank you.